Excellent. Okay, so the Maine Health Data Organization was established as an independent state agency back in 1996 and has been collecting data since then, hospital data, claims data. We collect financial data from hospitals as well as some quality data. And it's our responsibility in our governing statute to create a comprehensive health information database to assist with improving the health of Maine citizens. And we're also responsible for providing publicly accessible reports. And we'll get into how we're meeting that requirement as we talk about our new website, Compare Maine. The MHDO is governed by a board of directors, and the board represents consumers, employers, providers, hospitals, payers, and then there are state representatives on the board as well. Our current chair is Lisa Harvey McPherson with Eastern Maine Health System, and our vice chair is Commissioner Ann Head with the Department of Professional and Financial Regulation. So the purpose of today's discussion is, again, to review cost data that will be presented on our new website and focus on the cost spreadsheets that we sent out this afternoon with our initial round of data, and to really walk through and make sure those of you that are going to be impacted understand the methodology behind what's driving our numbers. The surgical procedures, if applicable, you will receive in July. So we'll talk more about that as we walk through the deck, but there are a number of procedures that we will be including on the website, for example, knee replacements, and that information is not in the spreadsheets that you've received this afternoon, but rather there'll be a separate set of information that is sent to you in July with those types of procedures. And lastly, you'll hear us talking about a strategy to integrate quality data with some of this cost data, and that information, again, if applicable, will be sent in July as well. So what are the MHDO's public reporting requirements? These requirements are defined in our governing statute, which is Title 22 in Chapter 1683, Section 8712. And not only does the MHDO have some public reporting requirements, but so does the Maine Quality Forum. And in the Maine Quality Forum statute, Title 24A, Chapter 87, Section 6951, is where the provisions are described. In Title 22, Chapter 1683, Section 8712, you'll see what the Maine Quality Forum is responsible for as it relates to promoting public transparency of the quality and cost of healthcare in the state in conjunction with the Maine Quality Forum. And I won't read through all the information that's on this slide. It's really more for your reference. But I want to underscore the bullet point that's in the middle of the slide that talks about the organization's publicly accessible websites and reports must, to the extent practicable, coordinate, link, and compare information regarding healthcare services, their outcomes, the effectiveness of those services, the quality of those services by healthcare facility and by individual practitioner, and the location of those services. So a lot in terms of the requirement for the publicly accessible website and the type of information that we are required to provide. And how we're fulfilling this and the requirements that you'll see on the next slide, which is described in Chapter 1683 as it relates to payments. And again, I won't read through all of this, but I think the key points are we are required to create a publicly accessible website that presents reports related to payments for services rendered by healthcare facilities and practitioners to residents of the state. And if you move down to the last couple of sentences, the website must also be constructed to display prices paid by individual commercial health insurance companies, third-party administrators, etc., unless prohibited by law. And then the last sentence describes how we need to keep this information updated. So the purpose of bringing this to your attention is, again, to lay out for you the legislative requirement as it relates to public reporting of healthcare payment/cost information and quality information. And the last slide in this section deals with the provision within the MQF governing statute, which requires, again, the MQF to report on healthcare provider-specific quality data. So what are we doing today to meet these requirements? Many of you may already be familiar with the Maine Health Data Organization's website, Health Cost, and that site primarily focuses on looking at average cost, which is the payment that is made to the provider. It includes both what the health plan pays as well as what the individual pays. For quality information, the Maine Health Data Organization also uses a tool called Monarch, which is a tool that comes from the federal government. Some of you might be familiar with this. This data is already out on the MHDO website. If you go to our homepage, you can click onto this link and access all of the data that we are presenting using this tool. And the tool that we're currently using is a version that's 2.0, and we'll be moving to an updated version, which is 5.2. And one of the primary advantages with the new version is, one, it's a little more user-friendly, the interface, and two, they have increased the number of measures that we are reporting on. So in this new updated version, there will be information by hospital, and right now we're looking at 36 main hospitals, 106 measures looking at hospital quality, utilization cost, and some information around avoidable stays. If you've not looked at Monarch, I would encourage you. There is a lot of information out there that you may be interested in. We also report quality information through our Patient Experience Matters website, which is a website that the Maine Quality Forum developed many years ago when we initially supported a voluntary patient survey using the AHRQ CGCAPS PCMH survey instrument. And I know some of you are familiar with this. Lots of information in this website. There were just under 300 practices that participated in this initiative, and we are doing a second round of surveying. It's actually already occurred, and we plan on posting new updated results sometime this fall. And then, of course, the Maine Health Data Organization working or helping to support the Maine Quality Forum on its annual healthcare associated infections report, which it's a static report, but we make available to the public on an annual basis. We're required to submit the report to the Joint Standing Committee on Health and Human Services, a committee of the legislature. And that report, again, is generated primarily from the data that we collect as a result of Rule Chapter 270, which, again, I know many of you are familiar with it. It's the quality measures that the MQF and MHDO work together in developing. So there's sort of the construct in terms of what is our legal authority to do this, how are we currently meeting the statutory requirements, and where are we going? And one of the things that I think we've recognized over the years is we've got all of this information, but it's in very siloed places and different websites. We're trying to support all these different websites, and there's a real opportunity to bring all of these things together in a more integrated way and to gain some efficiencies in terms of keeping the data updated and the QC around the quality control around all of these different data points. So an opportunity came up a couple of years ago. The Dirigo board supported the organization moving forward, as did the governor's office, to go out and apply for a grant that was an opportunity that came through to secure some funding to promote price transparency. And we applied, and I'm happy to say that we were awarded the first round of grant funding, and we then applied a year later for the second round. And so in total, we've secured about $3.7 million in grant funding to basically work towards the goal of integrating cost and quality, healthcare information, and developing a website that, from a user standpoint, is much more user-friendly. And so what we are going to be rolling out in September of this year is a new website that will replace the current health cost website, and it will bring in some of the quality information that's coming from Monarch and the patient experience websites, and create a more sort of unified view for the user. So the cost data that we're going to be reviewing today comes from our claims data that's submitted from the health plans, and we'll talk more about that as we get into the detail of the methodology. And the idea is this new site will allow for the comparison of cost information by procedure, by facility, by the 5 largest health plans in the state. And again, the development of this site has included input from a number of stakeholders, including a MHDO consumer advisory group that we convened over a year ago. And they've really been working with us to help us understand from a consumer's perspective what information is most important to them, how they define quality, what kind of information they're looking for in terms of cost. And so a lot of their feedback and recommendations we've used in beginning to put the website together. So in the interest of time, I need to speed things up, and so I'm going to work through quickly the next couple of slides. So key features of Compare Maine, you'll see the new logo on the top of the slide, health costs and quality. And I won't read through all of these things, but we have worked endlessly on retooling our methodology that drives the cost estimates. And we'll go through that in more detail in a few minutes. We are increasing the number of procedures, and if we move to the next slide, this will give you a visual. Our current health cost site that is out there that you can look at is what we refer to as Health Cost 2014, and you'll see that's the middle column in the table. And currently we've got about 159 procedures that you can view on health costs. And you'll see the various categories that those procedures fall into: office visits, lab, imaging, etc. And you'll see where we're going with the release of Compare Maine. We currently have under review about 310 procedures. I think we're going to end up probably somewhere around a couple of hundred when it's all said and done. But that just gives you a sense of where we've been and where we're going. And not only are we expanding the number of procedures that we're reporting on, but we're also expanding the number of facilities with cost information. So again, if you look at the table that shows health costs in the middle, Health Cost 2014, you'll see we're currently reporting on about 56 facilities, and it's primarily hospitals. Where we're going is to broaden the reporting as required under the law, and we're looking at reporting on over 200 facilities, which we define as hospitals as well as provider-based clinics or provider practices, imaging centers, ambulatory surgical centers. You'll see on the left-hand side how we define the facility type. Again, we're looking at integrating quality into this site, and for purposes of this discussion today, we just wanted to share with you that the MHDO board is in the process of making a decision on our direction relative to the integration of quality. We've recommended that we look at 3 quality measures, one being patient experience, which would include both hospitals and data that we have on, again, those practices that have participated in the MQF initiative, serious complications, and then healthcare-associated infections. There's lots to be said around this, and we'll come back with another webinar as we get closer to the release date to talk about the strategy that the board finally adopts for integrating some quality measures. So again, our new website is going to incorporate cost and quality information. We have been working to improve the user interface and utility, usability of the site. The site will allow for users to customize their results by their health plan if their health plan is one of the 5 that's listed. Maine Community Health Options, I do want to underscore, is one of the top plans based on our threshold. However, they're one of the new plans submitting claims data to us, and we have not yet received their claims data. We are anticipating that the end of this week, and we anticipate that they will be one of the plans that you can drill down into come the launch in September. Okay, the next couple of slides are just some screenshots of some of the work that we've been doing in pulling all of this together. And again, in the interest of time, I'm not going to go through these in detail. This is, again, these are not the final screenshots, but rather just a sketch of what we've been working on in terms of bringing all of this together. And that's what you see on slides 17 and 18. And I know that was a lot of information, and I think instead of opening up for questions, we want to keep on moving, because what's really at the heart of today's discussion is talking through the cost calculation methodology and the review that we're asking you to do on information that's specific to your organization. So with that, I'm going to turn things over to a colleague of mine who's working on our team, Margaret Mulcahy, and she will walk us through the next couple of slides.
Thanks, Karen Lee. Again, my name is Margaret Mulcahy. I'm an analyst at HSRI working on the Compare Maine website, particularly the calculation of the cost data. What I want to do in the next couple of slides is walk everyone through what to expect in their cost data spreadsheets and give them a little bit of background about how we calculated the numbers you'll be seeing. So as Karen Lee mentioned, the data comes from the MHDO claims data that was submitted from January 1st, 2014 through March 31st, 2015. And at a very high level, what we're doing with this data is listed out on this slide. So first, we're removing any incomplete patient encounters or claims data that come in without any cost data on the claim, or procedures that are just indeterminate. 2 very important things I want to highlight here is, for the purpose of this website, we're only considering commercial payers that are required to submit data to MHDO. So that excludes public payers. And because we're excluding public payers, we're also excluding data for those 65 years and older to make sure that we are most accurately capturing costs and not having any partial claims associated with a public payer for an individual who might be 65 years or older. Once we've made those criteria, excluded those claims, we go through and attribute the claim associated with the procedure of interest, and we'll be going over that in a second, to the provider using the NPI. So that's a really important piece of information. That's how we are attributing the cost and procedural information to your facility is using your MPI number. Once we've done that, we calculate the median total paid amount. And when we're talking about total paid, we're talking about contributions from both the insured individual and the insurer. And we calculate the median cost for both the procedure, for each unique procedure and facility combination. So hospital A might have 10 x-rays, and we were going to pick the median or the middle value to display on the website as the median or average cost. As Karen Lee already mentioned, we have an insurance filter that displays the median procedure cost by the 4 payers, which she mentioned on the previous slide. And we also show the insurance information across all the payers averaged together when applicable. And lastly, what we do is we create a statewide summary row that displays the median cost for each procedure at the state level to give consumers a reference point. Each of the spreadsheets we've sent out contain the following tabs, and we'll be going through a mock spreadsheet just so you can get a chance to look at what data we've provided. But real quickly, I wanted to go over what you can anticipate. There's a cover page that will include a lot of the information that I'm going through right now. We also have a procedure list. So the procedure list contains a list of all the CPT codes for which we've calculated data for Compare Maine, with the exclusion of those surgical procedures that Karen Lee mentioned earlier. It's important to note that not all facilities will have data for all procedures due to the analysis criteria I previously mentioned, but we wanted to provide everyone with a complete list of the health procedures we're looking at. Another tab is the NPI facility name tab. This is a very important tab to make sure that the information included here is correct and pertains to your facility, because as I mentioned, this is the information we've used from NPPES, the NPI registry, to attribute claims and costs to your facility. Some facilities, larger facilities, perhaps larger hospitals or facilities that have departments under them, might have several NPIs rolled up into one facility, and I'll say more about that in a moment. Next, you'll have 4 tabs associated with the 4 payers. There will be an Aetna, Anthem, Harvard Pilgrim, and Cigna tab. These would be the median costs for these insurance providers for the procedures they've paid for at your facility. And then lastly, there's an All Payers tab, which would be the average of median costs across all payers for the procedures performed at your facility. Lastly, this is very important, we have a feedback tab. We would ask that you fill this out with answering the questions we've posed to you and providing any additional feedback or information you believe is applicable. Right now, I'd like to take a moment to walk everyone through one of these spreadsheets. So as I mentioned, this is the cover page, and basically what I previously described is an explanation of each tab is repeated here for your reference. This is the procedure list tab. You'll see in the first column we have the CPT code associated with the tab, and then the second column we have the AMA description of that procedure. There are some instances where the AMA description of the more than one procedure is the same, and if that's the case, we've noted with asterisks to separate out the procedures. This might have to do with the length of time for a procedure or the amount of area of a body that was worked on. We've also grouped the procedures into categories that we are tentatively using to display on the website. Here's the NPI facility name tab that I mentioned previously. What you'll see here is the reporting name will be the same name as the title of your spreadsheet. This is how your information will be displayed on Compare Maine. So for example, if this was Hospital A, you would see Hospital A here in cell B1. That would also be the name of your spreadsheet. So when consumers go to Compare Maine, they will be looking up information with your facility by Hospital A. Again, if that is not correct or you wish us to use a different version of your name, you can let us know on the feedback tab. Here we have facility name, the other facility name that might be associated with your organization according to the MPI registry, the MPI number we're using, as well as the local address. Again, this is very important information to check over and ensure its accuracy, as this is what is used to drive all cost calculations. And here, if we're looking at imaginary Hospital A, you can see that there are 3 NPIs that are rolled up into Hospital A. For example, this might be just the hospital itself, and it might be perhaps a cardiac department within the hospital or the anesthesia group at the hospital. The next 5 tabs are the same, so for the sake of time I'll go through one, but know that this carries over to the others. At the top you'll see the data time period that we're reporting on. As I mentioned, it's January 1st, 2014 through March 31st, 2015. Each of these tabs will have a category. This again will be the category under which the procedure is displayed on the website, the CPT code, the AMA description, account, and the median total payment. And again, the total payment is the combined payment from the insurer and the insured. A couple really important things I want to note here. On this tab, you'll see 2 dashes. For procedures with fewer than 10 instances or fewer than 10 claims in our analysis data set, we're going to go ahead and suppress those to protect PHI and PII. So anything fewer than 10, you will not see a cost estimate for. Anything above 10, you will see a cost estimate. As far as the count column goes, this is described on the cover page, but it is important to note that this count is not a count of all the times this procedure was performed at your facility. As I previously mentioned, we're excluding claims from public payers. We obviously also do not have claims on individuals who are uninsured and whose visits are not captured with a claim form. And we also have a couple other analysis criteria that leads us to a count, and the count again is of claims included for analysis. So that's important, and I want to make sure we're clear about that. And we will be describing that quite clearly on the website. As I mentioned, the next 4 tabs are the same. You can see the variety of information, and here is an example of a time in which the AMA description was the same. It was for a thyroid measurement, but the types of blood tests were slightly different as indicated in the asterisks. Lastly, I'd like to direct us to the feedback tab. Here, if you could please fill out the name of the person that's reviewing this data, the date of the review, and the best email and phone number at which to contact them for follow-up. In general, we want to know if the facilities that we've grouped under your facility are correct, if we're missing any that you think should be rolled up into your facility, or if we've included a facility that actually should not be rolled up into your facility group. As I mentioned, please check the MPIs to make sure they're correct both for the listed facilities and also let us know if any should be removed or added. Contact information, let us know if on the MPI tab, this contact information that you see is accurate, as we'll be using this to report to the consumers. Lastly, when looking at the cost, we want to know if the reported median costs seem reasonably accurate given the differences between our data set and your data. Again, that we exclude the public payers, those not required to submit to MHGO, and how we're going to be removing certain incomplete or incorrect claims. So what we're looking for is directionally, does this data seem to resonate? Likewise, does the procedure volume seem accurate? I acknowledge this will be slightly hard to determine, but given that we're excluding the same items that are mentioned in the cost tab, does this volume number seem appropriate? Lastly, we have a placeholder. If there's anything you have concerns or questions about, please indicate that here, and someone will be back to be in touch with you. So I know that's a lot to drive everyone through. We will have time for questions at the end, but I do want to mention just a few more things on the slide. So as I mentioned, you're going to see cost data from a variety of procedure types. Those are grouped here for your reference. We have office visits, which would include any procedure falling in these categories. We have integrative medicine, mental and behavioral health services, physical and occupational therapy, emergency department visits, laboratory services, and a variety of radiology and diagnostic imaging services. And again, on that procedure tab, you will see each procedure broken out with its CPT code and AMA description under these general categories. As a reminder, we will be contacting you later this summer with data about surgical procedures and quality data if appropriate to your facility. And we would request that all written feedback is submitted by August 7th to the address listed here, comparemaindata@hsri.org. And just as a review, we are generally looking for information about the facility groupings, the MPI and contact information, the cost calculations, and the procedure volume. We really do want to pay careful attention to all the feedback that we receive, and to that end, any feedback that is submitted after August 7th, we will not be able to incorporate into the September release of Compare Maine. We obviously will work on incorporating that feedback into future releases, but we can't guarantee the timeliness with the September release. There may be some of you that if you feel that you have not received your facility's information and we're expecting it, please email us at comparemaindata@hsri.org. We believe that should be only a very small handful of you, if any. And if you have any questions that are not addressed in this webinar or any questions while you're going through the review of your data, please feel free to contact us at this address. And if you have questions more generally about MHGO or the Compare Maine website in terms of the material that Karen Lee reviewed earlier in the hour, please contact webcontact.mhgo@maine.gov.
Thank you, Margaret. I just want to take a minute before we open it up for questions to underscore that it's important as part of this process that we be transparent in terms of the methodology, these calculations, the information that we're putting out there. And as part of being transparent in this process, it's really important that we have those of you that are impacted by the information that we put up on the website, that we give you an opportunity to review the information, ask questions, I know many of you are familiar with the discussions that are going on. Seems like every year there is discussions around the importance of transparency and this type of information being available. And so we are obviously committed to that because our statute requires us to focus on promoting transparency. But as part of that, again, I feel like being transparent with those that we're reporting on is critically important. So although I recognize you all have crazy schedules and lots of other competing priorities, I hope that you do get the time to take a look at these numbers and ask questions if you have those. We will set up individual meetings as needed to make sure that people are comfortable with the information that's being put out there. I also wanted to take a minute to just, I didn't do this in the beginning and I should have, to just, I had made the comment that I have an amazing team of people that I'm fortunate to work with, and I do just want to take a minute. The MHDO went out a couple of years ago, again with the board's support, and put out a proposal to work with a consulting group to help us transform our operations, to do things more efficiently, to do more with less, to figure out how to leverage newer technologies. And so through a competitive bidding process, we had, I think, 10 responses to the request, and the successful bidder was Human Service Research Institute, partnered with NORC out of the University of Chicago. On the last page of the deck, you'll see a list of the individual members and their affiliation, whether it be HSRI or NORC, that are working on this project. So I just wanted to take that moment because we would not be where we are today if it wasn't for the support of this group. So just want to thank everybody and make sure that you're all aware of who exactly is the team of people working on this. So with that said, do we have any, Margaret, do we have any questions in the comments?
We have just one, and we're responding to that offline, and we wanted to remind everyone that the email will be coming from an @hsri.org account, so please check your email spam or junk folders for an email from that address.
Okay.
And the email with the spreadsheet will be sent to whomever the email was sent to, informing them about this webinar. So if you were forwarded the information about the webinar from an individual in your organization, it is most likely that individual that is receiving the spreadsheet.
So I know we started by saying given the number of people on this call, that using the chat feature would be the best way to pose a question. So I sort of hesitate to do this, but are there any questions that anybody would like to ask?
Can you hear me? This is Eileen Skinner at Mercy.
Yes. Good afternoon, Eileen.
Hey, how are you doing? First of all, we did not get any spreadsheets, so we'll contact you later to get that. But my question is if this is really commercial payment data, and I am in, let's say I'm already an Anthem enrollee, I thought that as an Anthem enrollee I could look at all the different prices that Anthem would pay to different providers for different services so that I can shop. So what's the advantage of this site to me as a consumer if I already have a plan? So who's this information for?
So that's been an issue that our Consumer Advisory Group has spent quite a bit of time talking about. And I think they probably, and I'd be happy to share with you some of the documentation that addresses this very issue, like who is the audience. But what the feedback that we've received is, yes, you can definitely go if you have insurance coverage. Most of the larger plans have cost calculators available to their members. And in fact, we link to those cost calculators from our current health cost website, and we plan to do that with the Compare Maine site. but I think that this gives some ability for comparison outside of your plan and across different providers. And I'd be happy, Eileen, to talk to you offline about some of the other use case that they've described. But, you know, the other thing is there's some pending legislation that has been debated in this last session, and it's been carried over to the next session, that if that is passed, this website would be a tool for, again, people that have insurance, people that want to shop and then share potentially in some sort of savings with their health plan. The MHDO Compare Maine website is being considered as the tool, as one of the tools to assist in that.
Yeah, I'm aware of that.
So I think there, so I think there are a number of different use cases, and as we've said, we, you know, there are all kinds of information. There's all kinds of information out there, and people can access information either vis-a-vis their health plan. They can call their provider. This is just another resource where we're hoping, based on the feedback from the consumers, that the integration of it and the depth of it is helpful.
Okay. All right. Thank you. And I will email you to see if we can talk offline.
Absolutely.
Okay. Great. Thanks.
Are there any other questions?
Hi, Karen Lee. It's Dave Stitzel with Aetna.
Hey.
Hey, we did get our spreadsheet, unfortunately, and I have a question. The feedback asked us to review the facilities grouped under our facility. Is that meant for the carriers to see whether or not those facilities and the NPIs and the addresses and the contact information is correct? Or are you sending that to all the providers combined from the various payers to clarify?
I'm going to punt that to Margaret.
Yeah, so thank you for raising that question. For the 4 insurance carriers, we apologize. That piece of instruction in that question on the feedback tab is just meant for the facilities themselves. So
I love you.
Yeah. We're not
Thank
you to review that. But I won't hold you back if you want to.
Nope. Thank you very much.
Okay. We were hoping you would just look at the cost and see if that seems reasonable for each facility with which you work.
Thank you very much.
Any other questions? Okay, hearing none. Again, recognize this is a lot of information to process. We are available. You've got contact information. I think people have my contact information directly. Please feel free to reach out to us. We are here to help assist you in this next stage of our process. And again, very much appreciate your time this afternoon and look forward to working with you as we get closer to our September launch date. Thanks, everybody.
Thank you. Bye.